Good morning, good afternoon, and good evening to our online audience who is joining from all around the world. Welcome to today's webinar on how parenting programs can prevent and reduce violence against children. My name is Jody van der Heyde. I'm a research consultant in the Justice and Violence Prevention Program at the Institute for Security Studies. I also coordinate the INSPIRE working group. I will be chairing today's session. There are a few guidelines for today's event. Please keep your microphones and cameras off until we've reached the question and answer session for today's event. The question and answer session will be conducted using both the chat function and the raise hand function in your Zoom application. Should you wish to raise your hand, kindly click on the reactions button to access the raise hand function. Please note that we will evaluate this event using a poll. This evaluation is completely anonymous and helps us to present better events in the future. Kindly do take a moment to do so, and it will be launched after the presentations for today's event. As we wait for the final participants to connect their audio, we kindly remind you to please keep your microphones muted and your cameras turned off. Kindly note that since this is a public event, which is being broadcast live on YouTube, Chatham House rules do not apply. This year, the Institute for Security Studies, the International Society for the Prevention of Child Abuse and Neglect, and the INSPIRE Working Group will jointly host a series of 7 webinars on INSPIRE, the 7 strategies for ending violence against children. INSPIRE is the leading evidence-based technical package for supporting countries in preventing and responding to violence against children. And I will be sharing links and resources throughout today's event in the chat box. Parenting programs are one of the 7 evidence-based strategies in the INSPIRE package. Evidence shows that parenting programs can effectively reduce and prevent violence against children by helping parents and caregivers to provide attentive and non-violent care. It is well documented that supporting parents and caregivers to learn positive parenting can prevent the separation of children from families, reduce the risk of child maltreatment in the home, reduce the risk of witnessing intimate partner violence against mothers or stepmothers, and reduce violent behavior among children and adolescents. Evaluations of these programs also indicate that this type of prevention is less costly than paying the price for the consequences of violence against children later in life. Approaches that support parents and caregivers can vary by the type of violence addressed, age of the child, and the way that policies and programs are implemented. Evidence supports a number of different delivery modalities as being effective, including home visits, group-based training, and support in community settings. But how do these programs work, and what are the key ingredients of successful parenting programs? Today, we are very grateful to have 4 expert speakers with us who will share their experiences and lessons learned, challenges, adaptations, and ingredients for successful parenting and caregiver programs. We will be together for the next hour and a half, and we really intend the next 90 minutes to be a discussion, and we encourage engagement from the audience. So please feel free to pop your questions, comments, and reflections in the chat throughout the event. In terms of how we will structure our conversation, each panelist will speak for about 10 to 12 minutes, and I will be using my powers as chair to be a little bit of a strict timekeeper, so that we can maximize time for discussion afterwards. After our final speaker, I will open to the audience for Q&A. So with that, I would like to introduce our first speaker. It is my pleasure to introduce Mike Kirakossian, a licensed clinical psychologist with over a decade of experience, specializing in integrative and trauma-informed approaches to mental health. He works with children, youth, and adults, developing and providing psychosocial interventions that emphasize holistic well-being. Beyond clinical practice, Mike has been contributing to humanitarian development and peace-building efforts. He collaborates with reputable national and international organizations focusing on mental health and psychosocial support, child protection, gender-based violence, disability inclusion, research, and integration. Currently, Mike serves as the Regional Mental Health and Psychosocial Support Advisor at World Vision Middle East and the Eastern European Regional Office. He's also a regional psychosocial consultant for the Middle East and North Africa for the Global Psychosocial Program Team at the International Federation of Red Cross and Red Crescent Societies. Mike will be sharing about the Nurture and Care Groups program in Lebanon. Mike, let me just share my screen and then please feel free to go ahead when you are ready. One second. Okay, Mike, please go ahead when you're ready.
Thank you so much, Jody, and welcome everyone to this very interesting and exciting webinar. It's a great pleasure to be amongst colleagues in such an expert panel. Today, as Jody mentioned, I will be sharing about World Vision's work in Lebanon about nurturing care groups. But before I do that, I would like to share something from my memories about my mother. I used to think that I was not able to achieve things in my life, but the power of nurturing of my mother helped me overcome a lot of barriers. And this is why ideas, thoughts, and mirroring behaviors is important when we really approach working with caregivers. Next slide, please. So we will speak about nurturing care groups, which is a project model that World Vision adopted and applied in several contexts now. And I will speak more about this in the next slide. So the nurturing care group project model is based on a care groups model that are part of WHO and UNICEF nurturing care framework. The framework enables the promotion of integrated behavior change messages and activities based on evidence-based, high-impact approach. So what actually is done in a nurturing care group approach? So first, nurturing care group approach is focused on nurturing and capacitating nurturing care group promoters, community health workers, or other groups of facilitators. It teaches volunteers how to promote behaviors from different sectors, and then have those volunteers promote behaviors and change messages to caregivers of children. As this cycle repeats every 2 weeks, as you can see in front of you, we are able to reach a multiplying effect and equitably equipping those communities to reach every participating household through neighborhood to neighbor contacts using interpersonal behavior change activities. If you look at the literature, this approach has achieved remarkable results compared to traditional behavior change methods. We have also observed that these outcomes in our 2 research studies from Ghana and Lebanon, where we will cover Lebanon's results today. Next slides, please. So why Nurturing Care Group, or NCG for short? And does NCG differ from other methods and approaches? So some differences on why NCG has an advantage over other approaches and models include, if you can click, please, Jody. Yeah. So coverage and relatively low cost. For example, the results from the Ghana study demonstrated a cost per beneficiary per year was only $3. One more click, Jody. Thank you. It mainly collaborates with volunteers for reaching households. The volunteers are from the communities and have trusting relationships with caregivers. So we're capitalizing on their trust relationships. One more click, Jody. Thanks. So the NCG approach also provides great opportunity for delivering multi-sectoral behavior change. It could be done both in a sequential and integrated model or manner. Next slide, please, Jody. Yes, one more slide. Thank you. So, yeah, the one before it. So the NCG child protection model includes 15 lessons focused on parents and caregivers to adopt and sustain positive parenting behaviors and reduce violent child discipline. The lessons include various topics to help parents learn new positive parenting skills, strengthen parent-child relationships, and apply positive discipline as an alternative to physical and emotional punishment. As I mentioned, NCG provides an excellent platform for delivering multi-sectoral behavior change strategies to improve sector-specific outcomes. Although today we are focusing on child protection, it is important to highlight that all three projects have been conducted in a multi-sectoral manner. We have observed significant reductions in physical and emotional violence by parents in both Ghana and Lebanon, which is very encouraging for the potential scale-up of nurturing care group. So the NCG is a relatively low-cost model with a short-term implementation period of 5 to 6 months, offering the potential for high population coverage and serving as a multi-sectoral delivery platform due to its design and delivery approach. The NCG model presents a realistic, evidence-based SBC or social behavior change programming opportunity sustainable for various contexts. Next slide, please. Just a highlight on the process for the nurturing care group child protection experience within World Vision. So during 2019 to 2020, the NCG Child Protection and WASH project was launched and concluded in Ghana. And in 2022, the NCG Child Protection and Education, which is what I will be speaking more to in a bit, was concluded in Lebanon. And currently, there's an ongoing process of the nurturing care group, child protection and spiritual nurture of children in Tanzania. Next slide, please. So here are some highlights and insights from our study on how nurturing care groups have influenced child protection and education outcomes among Palestinian refugee children in Beirut, Lebanon. I'll start with the context, and next we will speak more about the study, move on to our study objectives, and briefly discuss the methodology, review key findings, and finally, we'll discuss the implications and conclusions. So to speak a little bit about the context and the need, the context for our study focused on the severe vulnerability of Palestinian children in Beirut, Lebanon. These children face high levels of abuse, neglect, and exploitation. The stories and numbers are alarming. In a study in camps around Beirut, over 50% of children experienced physical violence and nearly 20% faced sexual violence. One critical issue is lack of legal protection for children, which exacerbates their vulnerability and exposes them to various forms of abuse and violations, including physical, emotional, psychological, and sexual abuse. Next slide, please. So the study had two primary objectives. First, we aimed to investigate the effectiveness of nurturing care groups, specifically the child protection and education modules. We focused on promoting positive parenting practices and reducing the use of physical punishment and psychological aggression among caregivers. Next slide, please. We employed a quasi-experimental design for the study, which included intervention and comparison groups. The intervention sites were in areas with high Palestinian presence in Beirut, while the comparison sites included adjacent locations to those sites. Our design included a waitlist comparison group to address ethical concerns, ensuring that all participants eventually received the intervention. Next slide, please. The intervention lasted 6 months, from April 2022 to September 2022, involving 1,390 caregivers. We provided 15 lessons focused on child protection and 6 lessons on education, tailored to addressing the specific needs and contexts of the participants, and also included lessons on early childhood development. And when we say modeling lessons, it is actually modeling behaviors. So the approach is different from the traditional parenting programs. Next slide, please. To speak about the outcomes, so our findings showed a significant impact on child protection outcomes. There was a 32 percentage point reduction in physical punishment and a 26 percentage point reduction in psychological aggression in caregivers who are participants. Additionally, we observed an increased use of stress reduction methods among parents, indicating a positive shift in coping strategies and parenting practices. In terms of education outcomes, we saw a 15 percentage point increase in parents engaging in activities that promote early childhood development. However, there were no significant changes in some areas, such as hygiene practices or how parents respond to children's distress. These findings highlight areas where further support and resources might be needed. Next slide, please. Our study's results were mixed. While we saw significant improvements in child protection outcomes, the impact on educational outcomes were more limited. Several factors might explain these varied outcomes, including economic challenges, the urban setting itself, and the specific needs of the population. These insights are crucial for refining and scaling up the nurturing care group model. In conclusion, our study demonstrated that the NCG model has the potential for high impact, particularly in improving child protection outcomes, even with short-term, low-cost interventions. However, the limited impact on education outcomes indicates a need for further research and possibly revising the educational components of the intervention to better meet the needs of the children and their caregivers. And with this, I come to an end to my presentation. Thank you so much for listening.
Thank you very much, Mike. That was very, very interesting and insightful. I'm sure that there are a lot of comments and questions, but I ask if we could please hold that right to the end of our session. I have some questions myself, but thank you very much, Mike. But I think we will move straight on. We will now introduce our second speaker and continue our conversation on parenting programs. It is my pleasure to introduce Dr. Isang Awa. She is the Head of Advocacy at the Global Parenting Initiative in the Department of Social Policy and Intervention at the University of Oxford. She is also a member of the university-wide Oxford Policy Engagement Network Steering Group. She holds a PhD in education from the University of Cambridge in the UK, as well as degrees from Harvard University and the University of Uyo in Nigeria. She has worked on the development and testing of Parent App for Teens, an open source mobile application parenting intervention that is based on the Parenting for Lifelong Health Teens program. More recently, Isang has managed the team's humanitarian parenting response in Ukraine, Pakistan, Syria, and Turkey, which involved collaborating with the WHO, UNICEF, and other international agencies. Dr. Isang will be sharing about the Parenting for Long Life Health in Tanzania. Thank you very much, Dr. Isang. Let me just share your presentation.
Thank you so much, Jody. You're going to share my presentation, right?
Yes.
Thank you. Good day, everyone, and thank you so much for joining us. Thank you, Jody, and the organizers for the opportunity to present at this webinar on how parenting programs help to keep children safe. I hope everybody can hear me clearly.
Yes, we can hear you perfectly.
I'm going to speak on parenting for lifelong health programs and share about how we are scaling parenting interventions to reach more families. The next slide, please. So there is evidence that parenting programs are effective in reducing violence in families, both violence against children and violence against women. They foster healthy family dynamics by empowering parents and caregivers with essential relationship and parenting skills, promoting effective communication and conflict resolution techniques that contribute to violence prevention. And in this way, they reduce children's exposure to violence. However, about a decade ago, there were very few available evidence-based parenting programs for families in low-middle income countries. So to meet this need, a team of academics collaborated with UNICEF, the WHO, and community partners to develop the Parenting for Lifelong Health programs, also known as PLH. PLH is a suite of open access, evidence-based parenting programs for parents of children 0 to 18 years old. And we have in the suite 4 different programs. We have PLH for babies, PLH for toddlers, PLH for young children, and PLH for teens. These programs have been tested in 15 randomized trials and found to be effective in reducing violence against children, preventing drug and alcohol use, improving the well-being of both children and caregivers, among other positive outcomes. And in 2022, PLH was established as a social enterprise charity in the UK. The next slide, please. Our mission at the Global Parenting Initiative is to provide access to free, evidence-based, playful parenting support to every parent everywhere, so that they have the knowledge and tools to help their children realize their learning potential and to prevent child sexual abuse, child violence against children, exploitation, and family violence. The next slide, please. This slide has our core principles. You can see them here. Evidence of impact, scalable and low cost, open source, non-commercial, adaptive, locally relevant, equitable partnerships, playful and empathetic. So those are our core principles. The next slide, please. For many years, PLH programs were delivered through in-person facilitation. So facilitators would be trained and they would go to a community and deliver the program to parents and caregivers over time. However, the team realized that this limited our ability to scale the programs. So in 2019, we started to develop an app-based version of the PLH for Teens program, and this is called Parent App. I'll speak more about Parent App and its development, piloting, and testing later on in this presentation. But I also want to mention that in addition to Parent App, during the pandemic, the team also went on to develop 2 other digital interventions, Parent Text and Parent Chat. Parent Text is a chatbot that delivers parenting messages, while Parent Chat is an online parenting support group delivered via WhatsApp. The next slide, please. And this slide, this map represents where we've had the PLH programs delivered. It also indicates which specific programs have been delivered in each of the locations. The next slide, please. And this slide has a diagram showing the scale-up of tailored parenting solutions within a system of delivery. And PLH is positioned at the forefront of a global movement to support parents with unique capability as a catalyst for scale-up of an integrated system of evidence-based parenting support. The next slide, please. In the last slide, I mentioned the scale-up of tailored parenting solutions. The question is, what is scale-up? Scale-up is defined by the WHO and expanded as deliberate efforts to increase the impact of successfully tested interventions. So to benefit more people and to foster policy and program development on a lasting basis. However, I know that scale-up can have different meanings in different contexts. One could consider scaling from one village to an entire community, from one city to an entire state, or from a state to nationally, or even globally. And each of these examples is impactful. But to understand scale-up better, I want to divert your attention to the graph. The horizontal axis represents scale-up that focuses on expanding activity.
Hi, this is Moose. Yeah, and he's 40.6. Thank you. We're early because we never know how long it'll take to get anywhere.
Hello?
Oh, sorry.
Okay.
Can I go on?
Please keep your microphones on mute. I'm so sorry for that. Please go ahead, Ihsan.
Sure, thank you. I want to say again that the horizontal axis represents scale-up that focuses on expanding activities to more locations or reaching additional populations through replication of the intervention. On the other hand, scale-up represented on the vertical axis involves institutionalizing interventions, integrating activities into already established policies, laws, government budgets, and institutional structures. So this often includes having the intervention integrated into existing healthcare, education, child protection, nutrition, and other community-based service delivery platforms. However, in order to achieve sustainability through scale, one must possess a dual focus on both vertical and horizontal dimensions. So it's important to note that horizontal scale-up alone won't ensure long-term sustainability, and vertical scale-up without horizontal expansion won't lead to the desired impact. So it must be both horizontal, and vertical. The next slide, please. And when you're working with interventions or programs and you're considering to take them to scale, here are 4 progressive phases that create the pathway to scale and sustainability. The first is the launch phase, which marks the beginning of the journey and is where we introduce our intervention or program to the world. The next one is adoption, and this aims to expand ownership of the intervention by encouraging its uptake and implementation by new organizations. The third is scaling, which refers to the significant replication and expansion of the intervention's reach and impact. And then the last one is sustaining. And during the sustaining phase, the focus is on ensuring the long-term sustainability and institutionalization of the intervention. The next slide, please. And I'm now going to briefly talk about the GPI, or GPI's Global Parenting Initiative, just in case I didn't say that earlier. So I'm going to talk about the GPI way of scaling. First, our scaling models are based on previously tested interventions. So if we're going to scale, it has to be a program that has been tested. In scaling, ownership of the project lies with the country team, and localization is key. Then in addition to, adapting the program to the local context, we work on embedding parenting programs within existing delivery mechanisms. And we also invest in advocacy efforts, and we take a program agnostic approach. That is to say, we are focused on scaling an evidence-based playful parenting program and not necessarily scaling PLH programs. The next slide, please. I'm now going to talk about or share briefly about the development of Parent App. I mentioned earlier that Parent App is an app-based version of the PLH for Teens program, and it was designed with and for parents of adolescents aged 10 to 17 years old. We developed it for offline use in rural areas or where there is no internet connection or affordable data. It's currently only in South Africa and Tanzania. And the next slide, please. It was developed and tested over a 6-year period. We started with formative research in 2019, and then in 2020, we co-designed the app with parents and teens, and we did user testing in 9 African countries. We subsequently did adaptation feasibility pilot in 2020, an adaptation pilot study in Tanzania in 2021, testing of the app, user co-adaptation optimization, randomized trial in 2022, and from 2023, we have been doing a cluster randomized trial of the app. The next slide, please. And based on this development of the Parent App, I'm going to share some of the challenges and the lessons that we have learned. So in terms of challenges, some of the key challenges we faced were limited evidence for underserved populations and low middle income countries. We found there wasn't much evidence in LMICs. And then there was low literacy, low digital literacy levels, low internet penetration in the area, which is why we had to develop, or we have had to develop the app to be for offline use. So you just need data to or internet to download it, but it's for after that you can use it offline. Other challenges: limited availability of smartphones, need for translations and cultural adaptations, very low enrollment, engagement and retention at the start. And I'm going to talk about what we did to address this shortly. Then there was low funding, and some of the lessons we learned were that users appreciated easy to read short messages, and some users prefer listening to audio messages, and a shorter time frame for the intervention increases retention. So rather than maybe use it over a very long period, condensing it would increase retention, and that the intervention needs to be engaging, and reminders and notifications go a long way in keeping users engaged. The next slide, please. With each phase of the study, so I mentioned earlier that we developed it over different phases. And with each phase of the study, we used the lessons learned in that phase for further refinement of the app. And you can see in this slide, the pre-post pilot in Tanzania, which had very positive results and showed significant reduction in physical abuse, sexual violence risk, verbal abuse, and corporal punishment. It also showed an increase in positive parenting, good parental supervision, and positive gender norms, among other positive outcomes. The next slide, please. So after the pre-post pilot, we did an optimization trial. And what this was aimed at was to find out what factors would lead to increased uptake and retention of users. And what we found out was that WhatsApp groups increased the time. So having users, putting the users or in a WhatsApp group increased the times that they opened the app, the number of workshops or models that they used and completed, and also increased the likelihood of them starting a home practice activity. In addition, we discovered that participants engaged better when they had the choice of which models they used and the order in which they chose to use the models. So introducing WhatsApp groups and allowing users to choose the order in which they use the models led to a significant increase in the uptake and retention of users. The next slide, please. And with that knowledge, the team went on to conduct a cluster randomized trial with 4,800 participants made of caregivers, children, and adolescents in Tanzania. The RCT was conducted in 80 communities in rural, urban, and peri-urban areas in Mwanza, Tanzania. 40 groups were given Parent App and 40 groups were given Wash App to use. There were about 30 to 50 families per group. The next slide, please. So one of the first things we found out was that there was an unexpectedly high retention and completion in the use of Parent App. Remember, we had done an optimization study which showed us what factors would help to keep people engaged in the app. So this is what it led to. There was a high retention. The next slide, please. And more importantly, the RCT results indicate that the app, Parent App, has very positive impacts on violence prevention, parenting, gender transformative behaviors, mental health, and economic coping. If I had more time, I would go into more details, but the results are very, very positive. The next slide, please. And with these results, we are currently working on scaling the app in Tanzania. And here are some of the activities that we have been engaged in to build the scene for this and get the buy-in from stakeholders. So we have done, we did a review of interventions, conducted an in-depth stakeholder mapping and analysis, performed a policy review that involved the analysis of existing policies already on related to parenting, violence against children, and child development in the Tanzanian context. We've also monitored and analyzed the policy environment in mainland Tanzania, conducted key informant interviews and policy brief with representatives from NGOs, government, and UN agencies. We've organized stakeholder meetings and workshops to ensure an improved understanding of the scale-up of parenting interventions and to develop a roadmap of the scaling up process. We've also conducted a dynamic and collaborative consultative workshop known as Scaling Labs, which brought together a diverse array of stakeholders from government agencies, international and non-governmental organizations, and civil society organizations. And from the insights from these labs, developed a comprehensive matrix to document the scaling pathways. So right now we have identified and are prioritizing 3 pathways: delivering the parenting program through stakeholder schools, providing training to religious and community leaders, and integrating the program with the National Early Childhood Development multi-sectoral program delivery. And our team is also involved in the formation of the Parenting Consortium in Tanzania. The next slide, please. So the next steps we are working on are to support the government of Tanzania and parenting stakeholders to develop a national evidence-based parenting package and a national coordination framework. We're also working on strengthening the infrastructure and technical capacity of the government to deliver evidence-based parenting intervention at scale, digitally and in person. And we're supporting the government to lead the development of a national scale-up strategy for evidence-based parenting interventions and facilitating the government to engage and share learnings in national and regional initiatives to support parenting and prevention of violence against children. The next slide, please. So here are some of the lessons that we have learned about scaling interventions. First is that scaling is a non-linear process, and it is marked by unexpected stops and starts. So adaptability and flexibility are important and essential. We've also learned that not every stakeholder or decision maker shares the same level of commitment or passion for our cause. So achieving alignment can be challenging and demands consistent evidence sharing and patience. Another lesson that we've learned is that government engagement can be a slow process and requires strong advocacy efforts to secure support and commitment. And another lesson is that seamless integration requires alignment with already existing processes and systems in the government. And this often leads to adaptations in our content or delivery style. So we have to be flexible and adaptable. And another lesson still is that we've experienced that time constraints, especially when relying on external timelines that are beyond our control, can pose significant hurdles. And this underscores the importance of advanced strategic planning and flexibility. Lastly, we have learned that adapting to the organizational structure is crucial for flexible scaling. However, all of these lessons have proven to be invaluable as we continue our journey of scaling for a greater impact. And we are very much looking forward to the scale up of evidence-based playful parenting programs to reach all families who need them so that children everywhere can be kept safe. Thank you so much for listening.
Thank you very much, Isang. That was fascinating, and it was really interesting to see how you bring the tech and digital side of things into parenting program, and that's quite a big debate that's been going on. So I'm sure there's lots of comments and questions, but again, I'll ask you to just hold on to it for a little bit longer before we get to our Q&A session. It is my pleasure to introduce our third speaker for today, Lauren Stevens, who is the Global Research and Evidence Advisor for Child Protection at Save the Children International. She works to make progress on crucial gaps in evidence around prevention and response of violence against children, working globally, but with a particular experience in West Africa and Asia. She has a particular interest in examining the effectiveness of interventions focused on the intersection between violence against women and violence against children. Lauren also provides technical support and capacity building on monitoring and evaluation for child protection in a range of contexts. She contributes to improved quality of monitoring and reporting, including the scaling up of the use of outcome measurement, and delivers training on ethical issues around data collection on sensitive topics. Lauren, thank you so much for joining. Are you okay with sharing your screen? And please go ahead when you're ready. Thank you.
Thank you so much, Jody. I hope everyone can see my screen okay.
Yes.
Great, thank you. So I'll be sharing with you about Save the Children's Safe Families approach, which for those of you on the line who've engaged with or worked with Save the Children in the past, this is an approach that used to be called Parenting Without Violence. This is a universal preventative program to reduce physical and humiliating punishment in the home. And we respond to physical and humiliating punishment as both a form and driver of gendered violence. We work with children, caregivers, and their communities to support families to better communicate, solve problems together, and encouraging adults to view children as rights holders and understand their children's development. We see Safe Families as having a unique design because it's based upon complementary activities for caregivers and their children. So while caregivers learn strategies to mitigate stress, discuss their family's goals, to share their attitudes to caregiving, and learn about child development, children are engaging in age-appropriate activities that include reflection and dialogue on gender values, gender equality, building their understanding of the support available if needed, and helping them to communicate with their family and with their peers. And at the same time, caregivers and other community members, as well as children, are engaging in community mobilization activities, which encompass reflections on gender roles, gender equality, caregiving roles. Finally, we do also link this to work to strengthen child protection systems, including the provision of child protection services. And where relevant, we also can connect this programmatic work with advocacy around legal and policy change on physical and humiliating punishment. So to share a bit more about the structure of this intervention, essentially it's a 12-week program that is delivered to successive cohorts within communities. And this includes 10 positive parenting group sessions for parents and caregivers, which seek to fundamentally change the way that parents view children. And we want to transform relationships based on ideas of power and control to relationships of mutual understanding and problem solving. At the same time, we have 9 sessions for children. The reason why it's 1 less is so that there can be a 1-week delay so that caregivers can always be informed about what content their children are going to be engaging with. And we, throughout the 12 weeks, also have moments for what we call the adult-child interaction, where caregivers and children come together and participate in joint activities. And we also have opportunities to conduct home visits for particularly those parents and caregivers of children under 5, because the children's group sessions are for children in the 6 to 17 age category. And those are also delivered in specific sessions for age groups. We've also recently added to the intervention additional adaptation for parents on the move. And in this diagram, you can also see at the bottom there that link to child protective system strengthening. Since this approach was endorsed by Save the Children as a standardized approach for positive parenting in 2017, we've used it in over 40 countries, and this is included in conflict and crisis settings. We implement this in partnership with local and international organizations, including consortium with other child-focused international NGOs through the Joining Forces Alliance. So just to share with you some of the feedback we've had from the caregivers and children who've participated in the intervention. I'm not going to read out these stories, but I just wanted to share them because I think they really demonstrate the fact that when we think about positive parenting, we're thinking, yes, about reducing physical and humiliating punishment, reducing violence, but also about strengthening the caregiver-child relationship, encouraging peer support between parents, and that we're also basing Safe Families really on the power of a snowball effect, the idea that participants take the ideas they're talking about in the group sessions and share them with their partners, with their friends, with their neighbors, with their relatives, and with others in community. But to talk a bit about the evidence we've seen for this approach. So since 2017, we've been conducting a range of evaluations and assessments related to the Safe Families approach in different contexts. And we've used different mixed methods behavior change monitoring tools, but particularly using a caregiver survey that has been based on the items in the mix, in the Alabama Parenting Survey, and tools from our pre-existing positive discipline everyday parenting approach. And we also have a child measurement tool that really seeks to examine child and youth resilience and psychological well-being that drew on the child and youth resilience measure that some of you may be familiar with. In 2021, we carried out a qualitative synthesis of outcome results, looking at 29 different reports from 12 different countries. And we saw some really promising findings, but we saw that we still had many different approaches being used in implementation around outcome measurement. And we invested quite substantial time in building capacity in the measurement tools we were using. And this has really moved us along because in the early months of 2023, we conducted a review of evidence that took a multi-methods approach. We used a quantitative analysis, a meta-analysis of 3 crucial outcome indicators that could be measured using the caregiver survey that I mentioned. This examined the reported use of physical and humiliating punishment by caregivers, caregiver attitude towards the necessity of using physical and humiliating punishment, and reporting of items that marked positive caregiver-child relationships. And we examined both any change on these indicators and also any associations between the indicator results and sociodemographic factors. And this drew on data from 8 different countries, including China, Cambodia, Somalia, Indonesia, Nigeria, Uganda, so a range of different contexts represented. At the same time, we also conducted a qualitative review of evaluation reports from a further 10 countries, which sought to examine what we were seeing in terms of qualitative markers of effectiveness of the program, but also looking at the effectiveness around transforming attitudes in terms of gendered attitudes to caregiving, and any findings we had around the sustainability of the approach. In terms of what we found then, so on the quantitative analysis side, across all the data sets included, we saw statistically significant changes and positive changes in the percentage of children who were reported to have experienced any kind of physical punishment or psychological aggression by caregivers in the previous month. This was following participation in the Safe Families program. We also saw statistically significant improvements in the percentage of caregivers who believed in the necessity. So that is to say, a reduction in the percentage of caregivers who believe that physical and humiliating punishment is necessary to raise children. In most of the data sets, we also saw statistically significant improvements or increases in the percentage of caregivers reporting positive caregiver-child relationships. Although I should mention there was one data set where this finding was the case, but was not statistically significant. So we were really pleased by these quantitative results, and this really showed us, okay, so in terms of behaviors around positive parenting and physical and humiliating punishment, this is really positive and exciting. What do we see then around gender transformation and associated factors like family decision making? So on this front, we saw some evaluation reports were presenting specific measurement around contribution to decision making, shared responsibility for childcare. But there were many evaluations where this was not really being examined. This was not something that we were touching upon yet. And so this was something we really committed to strengthen going forward, and I'll come back to this in a moment. What do we see though around linkages between sociodemographic factors and some of the results we're seeing? So one interesting finding that was that prior to engagement in the Safe Families intervention, we did see an association between gender and reporting of the use of physical punishment and as well as psychological aggression. And this is a finding we see with other studies where female caregivers often report higher use of physical and humiliating punishment, often because they are themselves holding a greater burden of childcare. What we found, though, was that in our data set, following participation in the program, this association was no longer there, which is interesting because it also suggests not just that we're seeing reduction, but also that we are in some ways changing the association between caregiver gender and the use of physical and humiliating punishment. What we also found, though, that was interesting was that we saw an association with higher levels of caregiver education, but also higher use of physical and humiliating punishment. That said, we also saw that caregivers with higher levels of education were also more likely to report more positive caregiver-child relationships. So there were some interesting findings there that we committed to come back to. On the qualitative side, and there's a lot here that I really don't have time to go into, but what we did see is that the majority of evaluations were reporting in positive changes for children at the child level as well. So increased knowledge amongst children on their rights and on violence, increased identification of self-protective behaviours and knowing where to go for help, and increased confidence in reporting any kind of violation of their protection rights. We sometimes also saw them themselves reporting improved relationships and communication with their caregivers. We did note, though, that we had some instances, bear in mind this review happened in the early part of last year, where there was challenges to progress due to not being able to implement the parallel children's sessions due to the COVID-19 pandemic. And I'll come back to this finding around the concurrence of sessions on this next slide. Because in terms of the factors that we're seeing that really help to strengthen positive change, there are a range of enabling factors we're seeing. The most commonly identified by different evaluations has been holding these concurrent sessions for caregivers and children and the adult-child interaction sessions. This is seen as a really key factor in improving caregiver-child understanding, relationships, and communication. Other factors included home visits, creation of trust in the caregiver group sessions, and really sustaining the process and ensuring that the full number of sessions is able to be delivered. Now, there are some challenges that came through around behaviour change, around physical and humiliating punishment. I've already mentioned the challenge we had around delivery due to COVID-19. We've also sometimes had challenges related to low coverage or low reach of positive parenting messaging in communities, which shows the really crucial role of linking to community engagement. We've seen an encouragement that we should better strengthen linkages to social protection and livelihood activities, given poverty is such a crucial driver of violence in many contexts. And sometimes we do see challenges where caregivers are not able to attend all sessions. In terms of the factors that seem to be coming out as strengthening transformation of gendered attitudes to caregiving, we're seeing that Strong communication approaches, including capacity and space for communication, shared decision-making, is an enabling factor, as is the incorporation of additional content targeting men, targeting fathers and male caregivers, and the use of male role models within communities and implementation. And the engagement with community dialogue and targeting of community members also comes through as an enabling factor for transformation of gendered attitudes. However, we do have challenges. Like many parenting programs, we struggle sometimes with male engagement in Safe Families activities. And of course, there's a really crucial role here of social norms, gendered roles and stereotypes, and gender inequality in communities. And sometimes we're simply challenged because there are such limited resources for basic services and community networks. This impedes changes in terms of gendered attitude to caregiving. But I want to take a moment to look at one of the studies included in the report, which is a quasi-experimental study in Cambodia conducted between 2018 and 2021. This compared an intervention group that participated in the Safe Families project with a comparison group that did not participate in the intervention. Caregivers were non-randomly assigned to these groups, which were in two different intervention or non-intervention districts. But techniques were used to create a valid comparison group while controlling for socio-demographic variables through fixed effects logistic regression modeling to really help us determine the impact of the project. This study is really rich and it is available online, so I won't give too much detail here. But what I wanted to share was that we did see that with this, with our control group design, that we saw that the project intervention did have the desired impact on the reported experience of physical and humiliating punishment. Caregivers who have participated in the project intervention were less likely than those in the control group to use physical and humiliating punishment. And we also saw a similarly positive change in terms of the belief in the necessity of physical and humiliating punishment to raise children. Caregivers who'd participated in Safe Families were less likely to hold this belief than those in the non-treatment group. So this is really positive and really encouraging us to conduct further quasi-experimental and experimental studies on this approach. As I'll come back to this, but we have quite a few next steps that I wanted to share with you because we're quite excited about how we take this forward. So where possible, we're really encouraging implementing teams to implement fully this approach. And what I mean by full implementation is this point around having the concurrent complementary caregiver and children sessions, because we really saw this as a key contributor to the effectiveness of the approach. We want to continue to engage in explicit discussion and learning on positive methods for increasing male engagement in these sessions, particularly because of this intention for this to be a gender transformative approach. We might want to consider, in some contexts, further mainstreaming gender or even delivering separate gender sessions, but we've really strengthened the gender content within the intervention activities. We also want to further investigate this finding we saw with caregivers' levels of education and the effectiveness of the approach. That's not a result we were expected to see, and it's one we really want to investigate further. And as I also mentioned, since we've recently introduced adaptation guidance for families on the move, we want to investigate them as a specific population. We want to do more to understand what changes we're seeing at community and systems levels, including potentially through social norms exploration. And we also saw that while often evaluations were kind of making assumptions that the changes might be sustainable, we've not done very much measurement historically on whether this is actually the case. So programmatically, we're intending to continue to develop strong exit and transition plans and identify resources to sustain intervention for as long as is necessary. But we're also exploring possibilities of doing post-intervention evaluation to really explore the sustainability of the results that we're seeing. We're aiming to consistently collect socio-demographic data to understand our survey data in more detail. And we also want to investigate further this linkage with the number of sessions a caregiver or a child attend and their results for them and their family. We've revised the Safe Families measurement tools within the last year to ensure that we can better measure gendered attitudes to caregiving using existing tools like the Gender Equitable Men's Scale, the Images Scale, and we're actually currently pilot testing those in Zambia as I speak. Finally, we're really strengthening the quality of evaluation and analysis that we're doing on this approach. And while given some of the conflict and crisis settings we deliver this approach in, it's not always practically or ethically possible to use a quasi-experimental or an experimental design with a formal treatment and control group. Because we're often rolling out in successive cohorts, we are looking at opportunities around using a more waitlist design to really use non-equivalent comparison groups to help to strengthen our understanding of the effectiveness of this intervention. And finally, we're exploring and actively seeking opportunities to conduct mixed method evaluation that closer examines this approach in relation to violence against children and violence against women intersections, including particularly attitudes to male engagement in caregiving and adolescents' own attitudes around gendered caregiving and violence against children and adolescents. Thank you so much.
Thank you so much, Lauren, for that wonderful presentation. And thank you for highlighting the issue of sometimes it's quite a challenge having male engagement or father or male caregivers participation. And it would be great to hear in the Q&A what kind of strategies you have used to increase males and father participation. But I think moving right on, it's great to see all the conversations and resources in the chat. But moving right on to our final presenter for today, it is my pleasure to introduce Ornella Barros, who is the Program Officer at Arigato International. She coordinates the implementation, monitoring, and evaluation of the program about nurturing the spiritual development of children in the early years. She has more than 14 years of experience in child's rights research and advocacy, with a focus on child protection, children's participation, and child's rights governance. Ornella is a political scientist and holds a master's degree in human rights from the University of Oslo. Ornella, when you are ready, please go ahead. Thank you.
Thank you. Thank you, Jody, and everyone. Thank you for the invitation. It's an honor for us to be here. Today, I'm here presenting on behalf of the Consortium on Nurturing Values and Spirituality in Early Childhood for the Prevention of Violence. This is an effort that started in 2018, together with 16 organizations that basically wanted to build on the big contribution of faith actors to children's rights and well-being, with a particular focus on violence against children. So basically, it really took us to that recognition of what are the capitals on which faith actors build and contribute to children's rights, which are access, social, and spiritual capitals, right? Because we do know faith actors has presence in areas where not even the states are able to reach communities. And we do know they do have a very important social status in communities, no matter how many conventions or treaties we bring to parents and caregivers. The religious leaders have a very high credibility among communities. So that is something that we also find important to work on. And of course, the spiritual capital, because they are also very important resort for social, emotional, and spiritual support for families. So based on this effort and 4 years of hard work, research, and piloting, in 2022, we got to launch the toolkit on spiritual development in the early years as a way to contribute to ending violence against children, with 3 main aims. The first one, giving opportunity for faith actors, parents, caregivers, and educators to really reflect on the importance of the holistic development of children, including the spiritual component, especially in the early years, with the second objective of really encouraging self-examination of those religious and spiritual principles, teachings, and practices that either kind of reaffirm the dignity of the child or also challenge practices that condone violence against children in child upbringing. And the third objective, really trying to provide these stakeholders with a very concrete tool that they could use for nurturing children's spiritual development and helping to support families and parents and caregivers in this process. So that's how this toolkit basically aims to reach organizations those who work with parents, caregivers, and educators, but also those who have close collaborations with faith actors, religious and spiritual communities, trying ultimately to reach children up to 8 years old. So we really understand that these stakeholders play a significant role in transforming the realities and of children, especially in the early years. But this process started with 3 premises. Being the first one, the idea of anyone working on children's spiritual development needs to be equipped to understand and to internalize why it is important, why it's important to work on the holistic development of the child, considering its spiritual innate capacity and how it contributes to protecting them and the children around them. The second premise is that it's not possible to work on children's spiritual development without working as adults on our own. And this is definitely tackling and addressing our own childhood experiences as adults. And the third premise really builds on what are the enablers, which this process led us to 3 of them, to actually foster and flourish positive and nurturing relations is the first one between caregivers and children. They're creating the safe, respectful, and violence-free environment for them. And the third one being those empowering experience. Children do need that opportunity to exercise their agency, to connect with themselves and with the world around them. That's how this toolkit basically involves a full package of conceptual framework, learning program for adults, guide for trainers, facilitators, organizations, religious leaders, and also a booklet on activities for children. Really trying to tackle that caring environment, family as the main unit of care, but also community members, including religious leaders, educators in the process. So the rationale around why spiritual development really builds on the affirmation of human dignity. We do know spirituality can be nurtured through many ways and not limited to religious environments or beliefs, although it's definitely included at that level. But as the CRC proposes, and of course, interfaith dialogue has taught us so far, there is definitely an agreement around the sanctity of human life in children and how we recognize them as persons in their own right and as right holders with the capacity to, exercise choice, but also develop their identity freely. That's how we do know more specifically, although the Convention on the Rights of the Child includes the spirituality of children in its different segments and preamble, there is Article 27 specifically that recognizes the holistic development of children as a right to a standard of living adequate for the child's physical, mental, spiritual, moral, and social development. Alongside with other CRC provisions, we really find spirituality as one of the multiple components that really address the holistic development of children as an approach that values the well-being and that responds integrally to their physical, cognitive, social, emotional, and spiritual needs. It really engages a broad spectrum of support system, including, of course, the family, but also the school, the community, to ensure children reach their full potential. And that's why this material is really addressing definitely and the parenting beliefs and practices, but rooting in the actual holistic care environment of the child. In early childhood development, as has been mentioned before, this is a very crucial stage in the life of children, definitely to really kind of invest in who they are or explore what happens around them and the world around them. This is definitely, as evidence has shown, a very critical stage for them to install habits, but also to prompt development of their capacities. When they are exposed to violent behavior, we do know, or neglect or maltreatment, we do know it definitely affects and has lasting consequences for their lives and for their spiritual safety and development as well. So that's how, for us, this material explains how the three main enablers for this process rely on nurturing, that parents and caregivers and educators use nonviolent forms of upbringing that affirm the dignity of the child. The second condition has to do that they create spaces and environments for children that are safe, respectful, and violence-free, so that they expose children to experiences that are empowering, that support the development of their agency and allow them to develop interconnectedness with others, to practice ethical values, and to develop a sense of community. So these are, when things happened in that direction, evidence suggests that you can see a reduction on the aggressive behavior or less risk of depression and anxiety, fewer high-risk behaviors, and even the reduced risks of substance use. Other benefits around it, you can see them on the screen, where children's spirituality is nurtured, are related to stronger mental health, or children are more able to deal with adversity or problem solving, decreased likelihood of engaging in criminal activity, or also becoming a perpetrator in their adulthood. But what then is the uniqueness of considering and incorporating the spiritual dimension of child development in parenting programs? We see kind of these two levels. The first one very much related to what brought us together here today, very much linked to INSPIRE and the strategies. Three of them in particular: they support parents and caregivers, social norms, and life skills. Because apart, like, the spiritual development of children contributes to ending violence against them by means of empowering the parents, the caregivers, the educators, to supporting, to reduce harsh parenting practices and creating positive parent-child relationships, right? It challenges those social norms and cultural norms that condone the use of violence, and strengthening norms and values that support respectful, nurturing, positive, and gender equitable relationships for children. But it also, of course, provides with the life skills by prioritizing social emotional learning and the development of prosocial behaviors. So that's definitely very much aligned to what has been presented so far. However, what we have been proposing as well is, additionally to these three elements of INSPIRE, is really digging deeper and reflecting deeper on that element of child dignity. So in that sense, spiritual development also contributes to improve social emotional well-being for children, as it strengthens interconnectedness with oneself and others. We know that positive relationships are a key contributor to well-being, as these relationships greatly influence children's mental and physical health. We know that spiritual development also found to be foundational in the development of children's resilience, particularly in children who have experienced adversity, by helping them to find meaning in life, to reframe the narrative of loss, to connect with the community around them. And also, when it comes to ethical values, when there is a critical mass of the population that is exposed to values such as respect or empathy or compassion or solidarity, especially in communities most vulnerable, and that capacity to reconcile differences, this has the power to become a flipping point for a societal transformation towards social cohesion. So here we are talking about the uniqueness, not only in, of course, the skills that are needed, but also in more of those like beliefs and social behavioral change needed for this purpose. So we have been doing the toolkit. The material was launched in 2022, but ever since we started working together with the Global Center for the Development of the Whole Child of University of Notre Dame to conduct a systematic implementation of this tool in Brazil, India, Mexico, and Pakistan. It's been a very interesting process in collaboration with Pastoral de Crianza, Shanti Ashram, World Vision, the Franciscan Sisters, and Islamic Relief worldwide. This has been an experience to really kind of integrate the materials and the contents to existing programs run by these partners. Ever since we are still in the process, we are halfway of this meal systematic implementation. And some of the emerging findings of success that we have been able to identify have to do with the recognition of the full spectrum, a very inclusive one, of parents and caregivers. Who are we engaging in these programs? How can we recognize, like, the importance in patriarchal context, for example, to engage male caregivers, as was also mentioned before, but also how do we recognize their childhood experiences in the process? For example, having parents and caregivers that had, in their childhood, had actually little or no exposure to formal educational settings affects definitely their attention span when participating in these kind of programs. Their literacy level definitely has a lot to say when it comes to how to make the contents friendly for them, how to take more time to break down certain experiences. The context is definitely, no matter how much you plan, how much you really try to put together for this to work, it's always important to keep in mind how external factors may influence or impact the implementation or the regularity in the participation of the children. And it varies from festivals in India to Ramadan in Pakistan, or just like the presence of criminal groups in remote areas of Mexico that prevent parents from coming to the sessions. But also, how do we recognize and put together programs that are ready to become also a support system for parents? So as good as the programs may be, the reality is that these families usually have more than one child. Therefore, coming to participate in parenting group sessions imply that either they leave their children behind, or simply they need to come with the children to the sessions, which definitely diverts parents and caregivers' attention and focus. So what are the solutions we are posing when opening these spaces for reflection and introspection for parents and caregivers? We also have been learning about the complementarity. How can we embed these programs in existing initiatives within the organizations? Because that's, as mentioned before, what the sustainability is. So definitely it needs to address, we have been implementing this. That's why not only in diverse, like, geographical context, but also different settings. So it's like how in Brazil it's incorporated into nutrition programs, or in India into healthcare programs, in Mexico into education programs, but also what kind of, if this is rural, if this is urban context, how can we actually make sure what we are putting on the table, it's actually being easily integrated and being and as a complementary tool to other initiatives that are ongoing. The adaptability and flexibility that was also mentioned earlier is definitely makes a big difference on how we find success in these kind of opportunities and learning programs, because parents and caregivers, I mean, their own, whether they are on the move or not, whether the partners are actually working through a voluntary kind of network of volunteers, or whether they have permanent staff running the program. Whether for meal systems we are collecting data digitally or electronically, or whether you actually are in so remote areas that you need to do data collection by paper. What does it imply when it comes to, later on to capture data and to do the analysis? All of these elements definitely make a big difference on how we take those lessons and adapt the program as well, and its implementation. And the ownership, I think that's one of the biggest achievements of this consortium, which is that the ownership of this material has been so easy, if you want to call it, just because it was collaboratively developed. And as you know, as needed as it is to have experts or bring experts to the table, it is also very important when designing these parenting programs to bring grassroots, because at the end of the day, those are the communities that are going to own and are going to disseminate these materials. So at our advantage, it is really useful to work on these programs collaboratively, trying to bring experts, academia, organizations, but also parents and caregivers themselves, and also trying to bring as many grassroots organizations as possible, because they are the ones knowing the communities better. So we hope there's going to be opportunity for you to explore more about the toolkit, the consortium, and hopefully if you have any questions, we'll be happy to address them. Thank you very much for listening.
Thank you very much, Onoda. That was very, very interesting. And I think that sometimes the faith sector or the spiritual sector is sometimes we tend to forget that they play a very important role in the prevention of violence and in creating peaceful societies. I see that your colleague has shared all of the booklets and guides in the chat. Thank you so much for doing that. I think at this point, I am watching the time. We do have time for a couple of questions. So I would like to open to the floor. Please, you are welcome to switch your camera on. Please introduce yourself and the organization you are representing. This is a very quick poll. If you would take the time to fill it out, please, it should take 15 seconds. It helps us to create better events in the future. Mark, I see your hand. Please unmute and ask your question. Thank you.
Thanks very much for a really informative session. Just an incredible diversity of ideas and issues raised that were very helpful. I work mostly in the United States, but I also work in sub-Saharan Africa with an organization called International Children's Aid Network. The focus being on the very large orphan population in that region. I have a question about, I think it's most of the approaches that were brought up today. It's impressive the scaling issues that you've all been able to achieve. What I'm curious about is the nature of the evidence for the impact. It seems like most of you are reporting on self-report, things like beliefs and change in attitudes. I'm wondering about the actual data on actual violence against the children, whether there's reports from law enforcement or children and family services, because there's clearly a lot of mismatch in the literature on adverse childhood experiences in terms of self-report and what's actually occurring. So I'm curious about the nature of the evidence on actual violence against children. Thank you.
Thank you, Mark. Would you like your question directed at a specific presenter? Okay.
No, I think that the issues were common to all the presentations in terms of what I heard, at least. I haven't actually read some of the papers that I know Mike shared, but it seemed like most of the data were coming from self-report survey work.
Okay. Would anyone like to go ahead and answer the question? Isan, go ahead.
Sure, I'm happy. And I think that's a great question, Mark. So my understanding is that, well, from what we've said, it doesn't seem to match the data, right, on the violence. I think the first thing, in terms of evidence, I want to point out that most of, well, I'm speaking for Parenting for Lifelong Health and a number of others. So the evidence, it's from rigorous, it's not from surveys, it's from rigorous research, specifically randomized trials. And in terms of the fact that they're still the report still shows that there are many children that are still going through violence or are still victims of violence. The thing is that I think it's important to find out that the scale of the problem, it's really much. So there is a paper by Dr. Susan Hillis that shows that about 1 billion children every year experience violence. So when you talk about that reach, that scale, that this is the scale of the problem, in terms of the impact that is being met, for instance, our PLH programs, I talked about the in-person programs, which have only reached about 300,000 people so far. And though we have developed digital interventions, we're still testing it. So I think that when we consider the scale of the program and the reach, there's still a wide gap, because the scale, the program is, the issue is really, really big. If you have 1 billion children experiencing violence each year, even if, let's say that we put together all the programs and just 1 million children are being, we have reduced violence or for just 1 million children, you can see that compared with the scale, there's still a wide gap that needs to be met. I don't know if that answers your question.
Thank you, Isan. Lauren, go ahead.
Thank you. And I think this is a really fantastic question. And I think the other part of the coin is the other side of the coin is also that where we are conducting surveys as part of routine monitoring and evaluation of our programs, but we also are really working to kind of build a relationship of trust and support with parents and caregivers. And I think that's really important, is that this isn't actually about collecting data to incriminate them as bad parents. This is about how can we best support you to be the best caregiver. And I think we have sometimes seen really interesting results where we see these really dramatic increases at midline because in reported violence, because actually the trust has increased so much between baseline and midline that they feel more comfortable being more honest. And then actually you see a decline by endline. The other point though that I think I'd like to come back to is you mentioned about things like reports with law enforcement. And while I think this is really valid and definitely something that we could explore more, the other thing to consider is a lot of the violence we're talking about is not violence that would ever be reported to law enforcement. You know, we're talking about violence in the homes, physical punishment by caregivers, smacking, things like this that are actually very rarely going to ever reach a formal service provider. And so there are always going to be limitations in how we measure and what we measure. But the fact that this is a kind of violence that often is not going to be ever seen by a member of law enforcement or a healthcare professional, for example, means that we have to also explore self-reporting as a really viable source of information.
Thank you very much, Lauren. Eleonora, I see your hand. Please go ahead.
Yes, this is really a quick question because I saw there was also an interest in the chat, and it's a question for Mike. I was wondering in the 15 lesson how you introduce also the element of faith and spirituality, since World Vision is also a faith-inspired NGO, and since I believe in the context of Lebanon, and you opened actually with sharing also the story about your mother and how she inspired you. So also if that was also, you know, faith, a faith inspiration or something that came from cultural, you know, not necessarily faith, but faith, spirituality, and culture, how this is introduced in the 15th lesson. I mean, I work with Ornella, and so in our toolkit, this is very evident because we really use the scripture, we use the stories, the rituals, and I was wondering if in the 15 lessons you have something similar as well. Thank you.
Thank you so much, Eleonora, for your question. To have a brief answer, in the study for Lebanon, even in Ghana, there was no involvement of direct spiritual nurture lessons. So of course, at the core of it, World Vision is a faith-based organization, and we inform our practice with the Christian values. But for the nurturing care group approach, there was no direct lessons related to faith-based approaches or direct scripture use in the lessons. So those were more directed towards modeling behaviors, as I mentioned, for early childhood development, education, and also child protection. I hope that answers your question, and thank you for remembering my story, my very brief story, but that was quite inspiring. I would like to answer, I'm sorry, I think it was Mark who asked the question, if I may, about the impact of the study. So I can answer for the Lebanon study. So we used a difference in difference logistic regression to calculate differences between intervention and comparison groups. So that was a baseline and endline. So an impact evaluation using the ID design allows for comparison of changes within intervention and comparison sites and improvements in outcomes on interest. So given they are statistically significant, we could identify as real impact, and that really attributes to the project. So that was intention behind the design. So we had two covariates, parent education and parent occupation, that came out as statistically significant differences between intervention and comparison sites. And both variables had been controlled during difference in difference regression. So for binary variables, we used, of course, robust to adjust linear DID regression. So that was the model. And of course, within the urban context of the Palestinian camps in Beirut urban, that is always a very tough job to look for already existing data that we can, formulate a different design for the study. So that was one of the barriers that we had when we were designing the evidence building around this study. I hope that helps clarify. Thank you so much for your question. It's a very important question.
Thank you very much, Mike. Any other questions from the floor? I see that the chat is really active, which is great. Any other questions? Mark, go ahead.
Yeah, just sorry, I'm trying not to hog the meeting here. I think the issue is less about statistical significance than about the nature of the data. You all have clearly some significant results. I think it's the difference between kind of self-report and actual occurrence. And I think just coming back to your comment, Lauren, granted, a lot of things are not going to be happening through law enforcement, but in many places, teachers can be reporters of incidences of violence that are happening, let's say, in the school environments. And certainly and certainly in the United States, that's a very common reporting function that never makes it to law, but teachers are seeing things too. I mean, I think there are other ways of getting at things like neglect and abuse that don't necessarily come through the law enforcement channels. And I think it would just be helpful to kind of see that in the same way that I think the length of the impact, and going back to your point, Isang, that these are hard, and the problem is monumental at a global level. So I don't mean to undermine that either. But certainly, even reporting of sense of well-being and betterment could be impacted by the fact that since you are there working with these families, that their tendency to report honestly may shift as a function of how long you're actually working with them, and may regress after you're there. And so I think there are a lot of things that could impact the long-term sustainability of the impact of these interventions. This is not to undermine, your work is amazing. I am so humbled by what you're all doing. It's just phenomenal. I'm just keen to hear more about the nature of the data, because we're doing very similar things with the orphan population. So it's challenging.
Thanks, Mark. Ornella, please go ahead.
Yeah. Thank you. It's so important and definitely so tricky. We haven't reached the point we are just about to apply inline, but something that we are already anticipating to what you referred to, Mark, has to do with the difference between disclosure and reporting, and how are we tackling and influencing through our programs and the process, as we say, in that caring environment. One thing is how we kind of empower and encourage children, parents, religious leaders, teachers to actually play their role, but understanding that for adults, who children are disclosing to, and who is actually witnessing that, and how do we take it from the disclosure stage to the reporting part of it as a systematic exercise, whether we are there or not. And this is something that I don't have the answer to it just yet, but definitely a question that we are trying to tackle, just because usually we think that it's enough when children just disclose, or we just, like, as individuals actually are not following these adults and caregivers may simply not know the system, or in the process of reporting, they re-victimize the child just because the story goes through 10 people before it actually reaches the right one. So it's like, how do we also kind of how do we jump not from the violation to the reporting, but actually tackle the disclosure phase as well, to equip the individuals to know how to respond and also provide support to the child in the process.
Thank you very much, Ornella. I see that we have a really great conversation going, and I'm asked if we could please push back for another 5 minutes to allow a couple of more questions. But of course, if you need to drop off, you have another meeting or other things that you need to do, that is totally, totally fine. Gwen, I see your hand. Please go ahead.
Thanks, Jody. Yeah, so good afternoon, everyone. My name is Gwen Derrymaker. I'm the Director of the Violence Prevention Unit in the Western Cape Government based in Cape Town, South Africa. And I just wanted to give some input on Mark's question regarding the quality of the data and his questions around validating the data through using publicly available government data. And maybe I just wanted to reflect a bit on the realities of data connection methods and mechanisms in the Global South. I mean, I can't speak for the Global South, but I can speak for South Africa. And we face such insanely high levels of violence, right? We've got 99% of our children have at least faced one ACE, and just our number of ACE exposures are just through the roof compared to most global north countries. That our government official data sources are completely unreliable, whether it's law enforcement, teachers, social workers. It's not reported, but also because violence is normalized. And so what interventions like parenting programs are trying to shift are seen as normal behavior for too many people in our societies. And so trying to find other data sources in my context certainly would just be not reliable, and RCT data is way more reliable than public data. Thanks.
Thank you very much, Gwen. Anyone like to respond to that comment? Or any other further questions from the floor? I see a couple of people have dropped off. I think if we do not have any other burning questions, I think we can begin to wrap up. The recording of this webinar will be available immediately after this event online if you want to go back. If you would like to contact me so I can put you in touch with one of the presenters, you are more than welcome to do that. So a last round of questions before we wrap up. And thank you very much for the great engagement in the chat. This really has been an excellent webinar. Okay, I think we can begin to wrap up. Thank you very much to our 4 presenters for your really excellent presentations. We will be having a webinar every month from now until the end of the year, so please be on the lookout for those. Thank you very much, everybody. And with that, we will close and have a wonderful day further. Thank you very much and goodbye.